We stay on this topic. The United Nations has warned that cuts to U.S. foreign aid risk reversing decades of progress in the fight against AIDS. In 2024, over 31 million people were in antiretroviral treatment, and AIDS-related deaths had fallen by more than half since 2010. But the sudden halt in U.S. funding has forced many prevention and treatment programs to close, raising fears of a sharp rise in infections and deaths. Let's listen in to what UNAIDS Executive Director Winnie Byanyima has said in a recent interview.
It is cruel. It is cruel. It is quite unprecedented. Because yes, we see that countries have different challenges, even the rich ones. Priorities can shift. But you do not take away life-saving support from people just like that. You make a plan. You have a smooth transition. You give governments an opportunity to raise the resources they need to fill in the space. We are saying to the donors, stay in the global solidarity that has led us to achieve this progress and work towards gradual, planned, sustainable transitions with the developing countries. So there's progress, but there are still gaps. And now the risk is real that with this sudden withdrawal of funding by the biggest donor and the gradual cuts by the others, we're seeing that new infections could rise. If plans are not in place to mitigate this, new infections could rise up by an additional 6 million. We're talking of 1.3 now, but they could increase by 6 million by 2029.
If the cuts continue, experts warn there could be over 6 million new infections and 4 million more deaths in the next 4 years, levels unseen since the early 2000s. Women-led HIV groups and research efforts, especially in places like Nigeria and South Africa, have been hit hard. UNAIDS urges countries to boost domestic funding and calls for international reforms to help sustain the fight. Despite the setbacks, UNAIDS remains hopeful about the resilience and ongoing value of global HIV efforts. Now we go back to our guest discussion with John Rossomando. He's a president at Viking Research Associates and geopolitical analyst. Thank you, John, for staying with us. What geopolitical factors might be driving this sudden halt in funding? Is it purely budgetary or more strategic, according to you?
Well, let's put it this way. This is just a shot across the bow to the United Nations that it has to do a better job of being an impartial mediator here. It's completely on the side of the terrorists. It has, done absolutely nothing to ensure that Gaza remains peaceful. That you have 50,000, by some estimates, Hamas terrorists, who blend in with the population, who use hospitals as bases of, operations. You had Mohammed al-Sinwar, who had a bunker under one of the hospitals in Gaza. You have, the Hamas constantly breaks international law when it comes to its endangerment of the population. Gaza is basically for Hamas one big human shield to protect against it firing rockets, sending provocations such as the murder of over 1,000 Israelis who were at a peace concert. I mean, we need to have a United Nations that is impartial, that is even-handed, and that does not cater to one side or the other.
And John, what role might other major donors like the EU or China play in filling this funding gap if they are willing to?
Well, they'll probably fill the gap. But this is a statement by the United States that the United Nations cannot be supporter of terrorists. It cannot include terrorists and to the terrorist-controlled Gaza Ministry of Health has been shown to use faulty numbers and to create an inflated death toll. I mean, most of the fighters, by reliable statistics, most people who have been killed have been Hamas fighters or those associated with them. Now, what we need is to have the Arab League step up and put together a governing plan for Gaza so that Israel can have its security, the Palestinians can have their freedom, and we can live in peace.
Thank you, John Rossomando, for joining us today and sharing your insight as president of Viking Research Associate